Hey, welcome to our Freedom from Suffering Now blog. I'm Dr. Steve Grinstead. Today I want to talk about the importance of understanding as much about pain as possible in order to effectively manage a chronic pain condition. The area I want to focus on today is the types of pain signals. When people experience pain, it's because we have built-in receptor sites in the body that send signals up to the brain to tell us there's a problem. Now, with acute pain, this is a really good system. It works very effectively. It has a great healing time process for acute pain. But when pain goes on for 3 months or more and becomes persistent or chronic pain, then we have to understand some of the changes that are happening. Now, there's psychological changes and biological changes happening. When the pain signal goes up to the brain interprets that signal to give it purpose, meaning, texture, intensity, type of pain, etc. And part of what happens over time with people living with chronic pain, that process starts getting distorted. And the person starts getting amplification of different psychological, emotional symptoms, and they don't have a plan in place to manage those. They start depending more and more upon medication to manage the psychological and emotional components of pain, and therefore they often run into some serious problems. If you're watching this video on YouTube, go to the link below to the complete Freedom from Suffering Now blog about this, which talks about the importance of having a plan to deal with both the ascending or physiological components of pain and the descending or psychological emotional components of pain. I also want to encourage you, if you're someone working with people with chronic pain or living with chronic pain, on April 9th through 11th, I'm conducting a really intensive experiential workshop here in Sacramento, California, to help people do that more effectively, especially if they have coexisting problems up to and including addiction. Freedom from suffering, I believe, is everyone's right. It's also a responsibility. And be responsible and help people living with chronic pain learn as much as possible about their pain condition in order to have a better chance. As someone who's been living with my own chronic pain for a long time now, I do want to tell you it is possible. The new way for me is actually preferable. I haven't had to suffer with my chronic pain for over 30 years, and I still, to this day, have to practice what I'm teaching to others. So please come back frequently, check out my blog site, look at the rest of the website. There's a lot of resources for people who are living with chronic pain. Thank you for your attention.